Hello, everybody. My name is Freddy Celedon, and I'm an athletic training bachelor's candidate. And today, I'm going to have my appraisal presentation with you guys for my evidence-based practice class. So for my question is, for a 25-year-old college basketball player with an ankle sprain, what proprioceptive exercise program is most effective for improving stability and proprioception in the lower limb? For my article, I chose the article called Effects of Two Proprioceptive Training Programs on Ankle Range of Motion, Pain, Functional, and Balance Performance in Individuals with Ankle Sprain. For the purpose quoted directly from the study is to investigate the effects of two post-acute supervised proprioceptive training programs in individuals with ankle sprain. For my study design, I chose to do a randomized control trial. The sample that was analyzed was a total of 34 participants, which only 22 were not excluded. The age ranged from 18 to 40 years old. Everybody had to have a sustained post-acute sprain to the ankle in the performance of functional or sports activities. The study also included males and females. The procedure of the study was with these 22 individuals randomly located to either a balance or a proprioceptive group. Both groups received 10 rehabilitation sessions during a 6-week period. Everything was assessed and tested by a professional, and there was a follow-up for 20 individuals within an 8-week period after training. The outcome measures range of motion, pain, functional performance, and balance were assessed at the beginning of the study and at the end of the study. The results are very promising. This study showed that balance and PNF programs improve in dorsiflexion, range of motion, and the majority of the performance measures in individuals with ankle sprain. However, something to consider. The PNF program was not capable of improving balance, performance, and pain. The top threat for this study was that they don't mention at all the presence of collegiate athletes in the study or elite athletes, so the patient may respond differently to the exercise protocol, having a higher demand, etc. The top strength, the age demographics show the exact age of the individuals tested and applies directly to the subject patient, which as mentioned before is a 25-year-old. For this study, the internal validity, the two top threats were the exclusion of the third grade ankle sprains and the exclusion of the medial ligament sprains, which are listed in the exclusion criteria on the study. The top two strengths, an orthopedic specialist confirms suitability for this study and for the assessments performed in the article. Also, participants were randomized assigned to the treatment groups. For the clinical bottom line, professionals providing treatment for patients with ankle sprains injuries can expect a PNF or a balanced rehab program that will result in improved dorsiflexion, range of motion, and the majority of the performance measures in individuals with ankle sprain. Something to consider, the PNF program was not capable of improving balance performance and pain. Also, in the exclusion criteria, the third grade ankle sprains and the medial ligament ankle sprains were not considered into the study. And the mention of the collegiate athletes in the study and the patient may respond differently to the exercise protocol. Implications for practice. Accordingly to the study at hand, slightly better results were achieved with a balanced program. And of course, I would have my patient follow this procedure that positively affects the athlete. With this program, it is expected to see an improvement in range of motion, pain, functional performance, and of course, balance. Comments and justifications. Comments, justification, and explanations. The exclusion of the third grade and medial ligaments are a big disqualifiers for this study. They should be included. Confidence intervals were not reported, and there is no mention of high intensity or elite athletes such as college athletes, as I mentioned before. Also, 3 hours a week of exercise is identified as high activity. And let's have in mind that the subject slash patient is a college athlete, which performs way more than 3 hours a week of exercise. And that's the presentation. Thank you very much.